hosting the webinar this afternoon, and I'll get a chance to introduce myself as well as the other panelists momentarily. Just a little bit of housekeeping. For a better experience, the attendees have been muted on entry. You'll notice that, and your videos are turned off. That's really a bandwidth issue for us. There's a lot of attendees. We have over 100 attendees. We've also turned off the chat feature, so please do use the Q&A box. There will be an opportunity for Q&A at the end of the presentation portion of this afternoon. We plan to spend about half of our time on a presentation, half of our time on Q&A, so we will have a lot of time, we hope, to answer your questions. While that Q&A will be at the end of the presentation, please do write your questions in the Q&A box as you think of them. You don't have to wait until the end. Please don't raise your hand. With over 100 attendees, I don't be able to find you to unmute you. So the Q&A box will be the way to communicate with us, and we are monitoring that. It's indicated the webinar is being recorded. It will be posted on the JCOIN partner website, where we'll also be posting the frequently asked questions. So Cameron, just a quick shout out to see if I've missed anything in terms of the housekeeping.
No, I think that's it. It's not you, it's us. The video and the audio are off, but please do use the Q&A. We'll be monitoring that throughout the call.
Great. Thank you so much. Okay, so again, welcome to the Justice Community Opioid Innovation Network, the JCOIN Rapid Innovation Grant webinar. We have 4 panelists today who will be presenting information about the JCOIN Rapid Innovation Grants, or the JRIG grants. And I'll let the panelists introduce themselves. So Tisha, if you could go first.
Hi, good morning, everyone. Really glad to have you all join us today. I'm Tisha Wiley. I am the Chief of the Services Research Branch at NIDA, which is where the JCOIN initiative sits. And I'm also, I oversee the JCOIN initiative as a whole.
And Lori.
Hi, everybody. I'm Lori Ducharme. I am a program officer in Tisha's branch at NIDA. I'm also the science officer for the JCOIN initiative, which is not a term that means anything to anyone except that I work with all of our investigators on sort of thinking big ideas about the science that they're doing. So hopefully I will encounter some of you at some point in that process. So thank you for being here today.
As I mentioned, I am Rebecca Hirsch. My role at George Mason University is I'm the Assistant Vice President for Research Development. But importantly for this effort, I am the lead on the JRIG grant initiative as part of the Coordination and Translation Center at George Mason. And Ed.
Hi, everyone. This is Ed McDarrell. I'm a faculty member in the School of Criminal Justice at Michigan State University. And I'm part of what's known as the Community Stakeholder Core that is part of the JCOIN network. And part of our role is to provide training and technical assistance, or to coordinate training and technical assistance to meet the needs of those of you from the justice agencies, behavioral health agencies, as well as the researchers that you may be working with. So thank you.
Excellent. So thanks so much. And we will all be presenting different aspects of this, but also be available to answer your questions at the end. So just a little bit about the agenda for today, what you can expect. We will be providing some background on JCOIN. I will review the JRIG call for proposals, do an overview of that call for proposals. We want to do a walkthrough of the application submission portal. This is different than if you've ever submitted a grant to one of the federal agencies, not NIH, it's not grants.gov. It's a portal that we have created specifically for the JRIG grants, and we wanted to walk you through that. Ed will talk a little bit about the technical assistance that he and his team and we will be providing. And then, as I said, we will have an opportunity for Q&A at the end, and we are going to leave a fair amount of time for that. So with that, I will let Tisha talk a little bit about JCOIN.
Great. So thank you. So what is JCOIN? In terms of the acronym, that stands for Justice Community Opioid Innovation Network. It is a large cooperative network that was funded by the NIH HEAL initiative. HEAL stands for Helping to End Addiction Long Term. This comes out of an appropriation from Congress to the NIH to launch an aggressive trans-agency effort to address the opioid crisis in multiple angles. It goes all the way from basic research on both addiction and pain all the way up to the kind of work that we fund through JCOIN. And in JCOIN, we're really focused on research that can improve access to effective evidence-based opioid treatment and related services for people who are involved in the justice system. Next slide, please. And so just I want to share with you, all of you, the overall vision that grounds everything that we do in JCOIN. And that vision is that every person who's involved in the justice system who has a substance use disorder should have access to effective treatment, both while they're detained as well as while they're in their community. And in service of that vision, we have 5 priority goals that we're pursuing as a network. The first priority goal is focused on generating new evidence about what works and how to effectively implement those things that work. We hope that over the course of the life of JCOIN, we will become a go-to resource for both researchers and practitioners. And to become that go-to resource, of really key foundation is developing a network of researchers who collaborate closely with practitioners across both justice and community-based service settings. We are seeking to build capacity to both conduct and apply research in justice settings. And ultimately, all of these things we hope are going to help speed the translation of science to solutions and create feedback loops between the field and the research. So this is one piece of that. Next slide, please. And so just to give you a sense of those, if you take each of those goals, I've mapped on some of the activities that we are doing in the network. So in terms of generating new evidence, that's all about the research that we conduct. And this Rapid Innovation Program is one of those key components of generating new evidence. We have lots of other activities that happen within the network related to that. That includes surveys, large-scale clinical trials, implementation studies, policy research, modeling, and other things as well. We're also, in terms of becoming a go-to resource, focused on dissemination. That includes communication and information dissemination of findings of studies, outreach to other key stakeholders. With regard to building capacity, we are focused on researcher training, practitioner training, technical assistance, and outreach to the field, and you'll hear a little bit more about that component later in this presentation. And then speeding science to solutions, we're really focused on stakeholder engagement. We have a steering committee that includes partners from many of the communities that are involved, as well as a practitioner board of leaders in the field across lots of domains. And this is all built on a cross-cutting foundation of that collaboration between researchers and practitioners. So I'm avoiding giving you the very large visual of all the different components of JCOIN, but this is all the pieces that are built into the efforts that we have going on through JCOIN. Next slide, please. And so we have 13 signature studies. Those are large-scale clinical trials, and as designed, those clinical trials are designed to reach 21 states and Puerto Rico, 87 communities. And across all of those studies, we expect we could reach more than 40,000 justice-involved people, directly enrolling 7,700 clients and 2,000 staff, and looking at outcomes from more than 31,000 client administrative records. You'll notice that on this map, there are lots of blank spots when it comes to the country. We do mean this to be a national network and a national resource. So we hope that some of you are from those states where we don't have any dots, because we'd really love to fill in this full map so that we have different projects going on all across the country. Next slide, please. And with that, I'm going to turn it over. I believe Rebecca is explaining the JRAG grants, so I will turn it over to her to talk to you a little bit more about what this is and how you can apply.
So thank you so much for that. So there's a lot of words on this page, and I apologize a little bit. This is pulled from the call for proposals, and we can go over some of this. The JRAG grants are a rapid funding mechanism, and they are designed, it is designed to support the small research projects on newly emerging policies and practices and interventions, things that are really just in time and that are not appropriate, as we'll talk about later, for traditional NIH funding. So these are, again, on studies designed on newly emerging practices, policies, interventions that address prevention and treatment of addiction in justice settings. Certainly, Very appropriate now, and for this call and for the remaining calls that we will have for JRIG, the COVID-19, impact of COVID-19 on the work that is being done with communities who are justice involved, individuals, and the organizations that work with those individuals would be, of course, highly relevant for this call for proposals. The applications can focus on opioids, as obviously JCOIN is focused on opioids, but it can also focus on other substance use issues, particularly substances associated with the overdose and overdose mortality. The projects need to have direct relevance to individuals, as we've mentioned, who are justice involved, but they need not take place in justice settings. And that's not a contradiction to the first bullet, which is you may be working with individuals after release from a justice setting. You may be working and surveying organizations, for example, that work with justice involved individuals in behavioral health, community health organizations. And so the work doesn't have to take place in justice settings, but needs to be relevant to individuals who are justice involved with substance use disorder. It is designed to facilitate these short-term projects that are not compatible with traditional NIH funding mechanisms. And that may be for a variety of reasons. It may be important to capture something right now that's something that is funded within 4 or 5 months will give you the opportunity to capture a new intervention or a new policy as it is being implemented, and that if you waited a year, that opportunity might be missed. We do welcome, as indicated, applications from individuals and organizations that work in research environment and those that do not work in research environments. So individuals and organizations that work in sort of partner organizations, as we call them, justice organizations, behavioral health, and community organizations as well. I want to emphasize that this is the first call for proposals, but it is not the only call for proposals. We anticipate releasing the JRIG call for proposals 3 times a year, currently planned around to be May, October, and February. Again, as we said, they are short-term turnaround, so we expect decisions within 4 months, and funding, barring any problems, would be within 5 months. And I say that because it's possible that you have an idea for a proposal, but it may not be quite ready for the July due date. Please know that there will be another call coming in October and one after that in February. We want you to put, obviously, your best proposal forward. So please don't think that this is the only time that you can do that. I want to talk a little bit about eligibility. So as you saw on the map, well, we are not everywhere in the country at all, and there are lots of people that are connected to the network, but don't have to be connected to the network. So there's lots of applicants out there that may be not connected to JCOIN, and so applicants can apply regardless of their current affiliation with the network. As we've mentioned, they can be either researchers or practitioners as the primary applicant. We've defined broadly research-initiated grants as faculty and researchers, postdocs, scholars at universities or other research organizations or other research relevant organizations. That is broadly defined as a research-initiated grant. And a practitioner-initiated grant are professionals in affiliated justice or behavioral health or community healthcare organizations. We will ask as part of the portal application process, you just select, is it a research-initiated grant or a practitioner-initiated grant? And that will just help us understand who is applying and the background of the organization of the person applying.
Rebecca, can you just speak up a little bit more?
Sure.
Awesome. Thank you.
Yep, we have some noise in my neighborhood apparently. So let me try to do that. Do you need me to go back, or was that okay? Do people hear that?
I think you're fine. Just the adjustment to the microphone was helpful.
Okay. This is really a note for researcher-initiated grant applicants who already have existing NIH funding. And we want to make sure that it is clear that JRIG funding is not intended to provide supplemental funding to existing grants in lieu of the pursuing a more appropriate NIH supplement or other appropriate NIH funding. These are really different than the typical types of NIH funding. It is not intended to prolong ongoing research when current funding ends for a project that you already have, or serve as some kind of bridge funding for that. And we do ask research-initiated applicants who have existing NIH funding, if they're just not sure if the idea is really something that would be more appropriate for either a supplement or other NIH mechanism, to speak with your program officer at NIH about your grant and what you want to pursue. So just a little bit about the funding. JRIG projects will be funded, and the projects are up to 24 months. They don't have to be 24 months, but they are up to 24 months. The total budget may not exceed $100,000 in direct costs over the entire award period. If it's a 24-month project, it is not to exceed $100,000 in direct costs. We'll talk a little bit about what may be included in those direct costs. F&A, or indirect facilities and administrative costs, may not exceed 10% of total direct costs. So again, $100,000, that would be $10,000 in direct costs. If it is less than that in direct cost, it is still 10% of the total direct cost, may be charged as an indirect cost or an indirect fee fund. Just want to talk a little bit about what the JRIG funding can be used for within an application. I wanted to point out that certainly personnel costs associated with the conduct of research, the researchers working on the project, or the practitioners working on the project, would be appropriate. It would also be appropriate if you are delivering an intervention that is directly related to the research. And so you may be trying to implement a new intervention, and you want to see how that might be different than your standard of care, but you're going to take that as part of a research project and look at that and collect some information about that. The delivery of that intervention in that case would be an appropriate cost, and the personnel associated with that would be an appropriate cost. And that's contrasted a little bit, or contrasted quite a bit, with personnel costs for the routine delivery of services. If you need additional staff or nurses in a healthcare organization or other staff to provide routine delivery of services that you would be doing even if you weren't doing this research project, then that is outside the scope of what the funding should be for. It's not to beef up your staffing for routine care. Other parts of the budget include, of course, the travel costs associated with the research. If there are any subcontract costs, you may be needing to work with an organization outside of the applicant organization. You can include those costs. Please note, again, the subcontract costs are part of the $100,000 in direct costs. When we get to the portal, we'll show you indicating that you should submit a subcontract budget if you're having a subcontractor. Materials or supplies that are needed for the conduct of the research, again, not routine materials or supplies, but those that are needed for the conduct of the research should be included. Again, consultants and computer costs. We note here that in some cases, organizations may not have an IRB, an institutional review board, the board that reviews the protection of human subjects. And some people use external IRBs to review their protections. You can include those costs as needed in your proposal. Again, just looking at what cannot be used, needles for needle exchange program are just never appropriate for NIH-funded research projects. So again, just want to reiterate again, in terms of the cycle, the call for proposals will be released up to 3 times a year. This is the first call, but we plan to have a call in October and then one in February. The decision is made within 4 months and funding within 5 months. Please note that these are really competitive grants. It is planned that we will have 3 to 5 applications per year funded across all 3 cycles. I also wanted to point out, though, that if you're waiting for to submit in October, that's perfectly fine. We're not going to fund all of the applications from the May call for proposals. We recognize that we have 3 calls for proposals during the year, and we want to plan to make sure that we have funding available across all 3 of those calls. So again, 3 to 5 applications funded each year across all 3 cycles. I wanted to take just a little bit of time to walk people through the application platform that we have developed for the JRIG applications, because it is something different than what you may have been familiar with if you have submitted proposals through other federal agencies. This is not a live demonstration because I was a little nervous about how the internet might work, so we have taken screen captures, but I'm going to walk you through what that will look like when you first click on this link, which is included in the call for proposals. You will be taken to the very first thing is a sign in or creating an account. If you've already created an account, you'll just put your email and your password. But for most people, they will need to create an account. Down at the bottom. It says need an account, sign up. When you do that, you'll be taken to the sign up page, which simply asks for an email and a password and a confirmation of that password. Very easy to sign up for to be able to submit through the portal. You will be asked to create a profile. This is really quite simple. It is your first name, last name, and email address, but it allows us to understand who the people are that have created the different profiles within the platform. So you will click where it says create a profile to get started. When you do that, again, you'll be taken to the profile page. You will see that this is currently in draft because it has not been completed yet. I ask you to put your first name, last name, and email address, and then you can save it. You'll also notice now, because I have logged in, that it says welcome RK Hirsch at email in this right-hand part of the screen, and that it is recognizing that I have logged in. Once you create the profile, you'll see that you now have a profile. You can view or edit that profile for some reason if you needed to change an email address or do something here. But you will see now that the profile is complete. A little check mark and it says complete. To get started is really how you enter the home page, or how you enter, excuse me, the application platform to begin populating the proposal submission portal. The bar is blue if there's action required. It'll be red if there's an error. There will be a submit button that becomes available once that you have created a proposal. So you would click the big box with the plus sign to say get started. And you will now be taken to begin your profile application. Currently, you'll see in yellow here, you haven't done anything yet because you don't have a title for your name. When you come back and you've given a title, you will have the title there. But right now, this is you're beginning a brand new proposal. And so it says that you need to edit this proposal. You need to start it actually. You will also note down here for proposal submission, it is a countdown. It will tell you the number of days that you have remaining to submit the grant application. The button to submit is grayed out until the application is complete and ready to go. And then it will turn green and allow you to click and submit the proposal when you've completed the application submission process. I wanted to point out when you first go into the portal and are ready to provide the information needed, the first thing you'll see is actually the call for proposal is included in the application platform. And so you don't necessarily have to go back and forth. It is all in the portal as well in case you need to look back again to see what is required. So I've just shown that here. Then you'll get to what we call the cover page information. This would be a cover page if it was one single document. But it is just asking for the principal investigator's name, that is the individual responsible for the overall conduct of the project, and the affiliation, where that individual works. The position or title of the PI is not actually required, but the email and phone number are required here. In the box at the very bottom, you can put other co-investigators, senior personnel, people that will be working on the project with the PI, but their detailed information is not required for this part of the portal. So this is just showing that it is completed, and my name, as affiliation. The individuals with whom I am going to be working is in the box stated co-investigators. At the bottom of that cover page form is the administrator contact, and that is the person typically responsible for the fiscal aspects of the grant at your institution. That can be a comptroller, your accountant. In many universities, it is the Office of Sponsored Programs. And so we just want that person's name and email address in case there are budgetary issues that we need to work with your organization. Again, as I noted, you will indicate whether it's a researcher-initiated application or a practitioner-initiated application. At this point, you can put the title, just because I'm in a happy mood, I've entitled my proposal, The Best Idea I've Ever Had. I say that because you'll then see that when you log out and log back in, now that I have given the proposal a title. The project duration is 18 months, and the total costs, including the indirect costs, is indicated here as well. So that is the first part of the application. That's what we call the cover page. Part 2 is the project narrative. And again, in the portal, you will see the instructions for what is needed in that project narrative. It is up to 5 pages. It'll describe a little bit, again, from the call for proposals, things that you might want to include, important information that you want to include in the 3 primary sections of that narrative: significance and importance, innovation, and approach. You will be provided an opportunity simply to upload a single project narrative, and that can be a Word document or a PDF, whatever you would prefer. It is you select the file and you upload it. Part 3 is the characteristics of the study population, and as you may have seen in the call for proposals, that is a requirement of NIH. It is what is called the Planned Enrollment Report, if you're familiar with NIH applications. We recognize that you may not always know the gender, sex, race, ethnicity breakdown of the study population. What we ask is that you give your best estimate. If you do know it exactly, that's terrific, but to give your best estimate. That is a form that you can download. The PDF of that, the link to that is included on the platform. It's included in the call for proposals. You would download that form, you would complete the form, save it, and then re-upload it where it says select a file and to upload that form. The next section is the protection of human subjects. We are simply asking, are human subjects, are people going to be participating in your grant, in your study? If you indicate yes, you will be asked, are you already working with an institutional review board that can review the protections of those human subjects? It may be your own IRB, it may be you're working with a collaborator's IRB, or it may be that you will need assistance with IRB approval. Any of those are really fine. There is no penalty for not having an IRB. We just want to know if you're going to be needing assistance, should you be decision made that this would be awarded, then an IRB review would be necessary, and we can assist you with that at that time. So that's the reason for those questions. The next section asks for biographical sketch in sort of federal government terms. There's also a resume. We're asking for a 2-page biographical sketch. Ed will note later during our technical assistance, there are a variety of technical assistance support documents, including examples of biographical sketches if you're not familiar with how to create one. It is required for the principal investigator. We suggest that you would also include biographical sketches for the other key personnel working on the grant. We've indicated 2 places where you can do that. If you have more than 2, please email us and we'll tell you how that you can provide more than 2 biographical sketches. So also you may be working with a current JCOIN affiliated, we call sponsor or collaborator. If you are, we would want to know that, and you can also include their resume. The next section is the budget and budget justification, or the budget narrative. And here we describe again what the call for proposals includes in the description of what is needed in the budget and the budget justification. So you will see that again in the platform recreated from the call for proposals. We are providing a form, a fillable form. If you're not used to doing budgets or wasn't sure how to do that, there is an example of the budget that you can download. The link to that, you can complete that fillable table and then re-upload that. You can also use a Word document or an Excel file if you are familiar with creating budgets. We ask if you have a subcontractor to also submit that subcontract budget. Again, recognizing that all direct costs are $100,000, including the applicant organization and the subcontractor. Then we're going to ask for a budget justification, and that is the narrative that provides a description of the different elements. Personnel, who is on the project, what will they be doing, for how much time will they be working on the project, if you're traveling to where, if you have supplies, what those might be. In case of a subcontractor, who that subcontractor is, and the work that they will be doing. All of that is just in narrative form, and that is a Word document or a PDF that you can upload. If you have letters of collaboration, that's the last part of the platform, you can certainly provide them. It's not required, but if you have a subcontractor or a consultant or other organization that you are partnering with, certainly that would strengthen your application, and it would be appropriate to put those letters of collaboration in here. It would be a single document. If you can create just one document and upload that here. At any time during the time that you're putting together the proposal, you can save as draft your application. It will save it. You can come back to it. And so you'll see that at the bottom it says save draft or save. The reason that I've indicated here, if save is really for when you've completed the entire package. It's not yet the submit part, but it is all of the required elements are included. So if you hit saved and not save draft, you will get an error that says field is required in whatever the required element of the platform that you have not completed. So instead, we ask that you hit save draft. It will save all of the work that you have done. So when you come back to the portal, you can start where you left off or go back and review or make any edits that you might need to your application. So as I mentioned, if you log out and log back in to the portal, you now see that the proposal that you have started, which has a title, is now included. That is at the bottom. That is the proposal that you've started. You can start more than one. You can have more than one at any given time. So that, again, when you come back, you would click that, the proposal that you started. It's blue because there's action required. You have not finished certain sections of it, and so it still remains blue. So you need to fill those sections in before the submit button becomes available for you to submit your proposal. So I know that was a lot, and I know we'll take lots of questions at the end of the presentation. With that, I wanted to turn it over, Ed, to you to talk a little bit about the technical assistance that we are providing.
Well, thank you, Rebecca. The JCOIN-CTC, and the CTC stands for the Coordination and Translational Center of JCOIN, provides training and technical assistance to local justice and behavioral and community health agencies and researchers on a wide variety of topics. This includes providing support for those of you who are considering development of a JRIG proposal. The call for proposals that Rebecca just went through in the portal, and I give all kinds of credit to Rebecca and her team. It's really well done and lay out the proposal very effectively. But what we've tried to do is to provide some additional resources to support your proposal development. These include a sample proposal, a proposal development checklist, and a short document that includes some tips for successful proposals. We encourage you to review these materials as you prepare for the proposal. Beyond these resources, we're happy to work with any of you on issues and questions that might arise as you prepare the proposal. A common question that we often receive from justice and behavioral health professionals is, how do I find a researcher to work with us on this proposal? We may not have a specific individual in mind, but we can offer suggestions for reaching out and identifying potential research partners. You may also find that you come to a section in the proposal and you're just stumped on how to respond. An example might be a question about various methodological approaches that you're considering. Although we may not have all the answers to those questions, we'd be happy to talk through the issues that you're encountering. Some of these issues might be addressed by resources that already exist within JCOIN. For example, you'll see in the call for proposals that you're encouraged to use research instruments that have been developed in prior research and adopted as common measures within JCOIN. We'd be happy to help you access those resources and or talk through decisions you need to make in developing the proposal. And as often happens in proposal development, questions will arise that you did not think about until you got to a particular part of the proposal itself. So we encourage you to reach out and raise any such issues and pose any questions that you are struggling with. The key message that I can offer is that there's a training and technical assistance team here that's happy to assist in any way we can. Next slide. As you will see, if you have questions on the JRIG funding, Rebecca, can you forward that to the next slide? Okay.
To do that right now. So hold on
Okay.
just 1 second. There we go. Sorry
Okay,
about that.
there we go.
Got a little stuck.
So, yeah, I had to catch myself when I said, as you can see.
Yeah, nope. I meant to, it just wasn't working.
If you have questions on the JRIG funding opportunity or a request for technical assistance, please email at jcpilot@gmu.edu to request that assistance. As previously mentioned, there are resource materials to support the proposal development. And as you can also see on the screen, the web link for accessing those resources is provided here. And finally, please note that we are scheduling a webinar on the JCOIN Common or Core measures. Although they're not required, you're strongly encouraged to use the common measures in your JRIG proposal, when they're appropriate and when they're applicable to the research questions that you're posing. So thank you, and let me turn it back to Rebecca to wrap this up and move us into the Q&A.
Thanks so much, Ed. I wanted to point out that this link is also included on in the website, in the partner website. It is included in the call for proposals. It's pretty much everywhere where we can think to post it. We've posted it so that you can have access to it. These slides will also be available, so you will have access to that link. So you can find those materials. If you're having any trouble with that, again, please let us know. So with that, I'm going to just wrap up a little bit on key dates. The first key date was May 29th. That was when the proposal submission portal opened and when the countdown began on the days until you can submit. And it's also when the call was released. As Ed mentioned, we are going to be talking about common measures and why it's really important to consider using common measures in a webinar in late June. That information will be released shortly so that people that are interested in that, and we really hope you will be interested in that, will also attend that webinar. Probably the most important date that people are interested in is that July 22nd at 11:59 Eastern Daylight Time in the evening, that should be PM, I should make sure that that says PM, is the proposal submission date. That is when the application portal at midnight on the 23rd, the application portal will actually close. You will not be allowed to submit an application in the portal at midnight on the 23rd. So 11:59 p.m. Eastern Daylight Time is when you need to submit the proposal by on the 22nd. We are hopeful and plan with a rapid review cycle to have the award decisions for this first round of applications to be made in October-November timeframe, with awards 1 month later. Again, working with the applicants that are selected for award with any issues that they need to attend to in order to be able to make those awards at the end of this year in December 2020. So with that, we are at the end. We ask that you please put your questions in the Q&A box. As I mentioned, we'll be responding to the questions, of course, live, and the recording of this will be on the partner website, but we will also be including a frequently asked questions. So we will transform the oral questions and answers to the written form. We will update that. So while I expect a lot of questions will be generated from this webinar, there may be others that come in through the jcpilot@gmu.edu email address, and we want to make sure that that is a dynamic frequently asked questions, so we can answer your questions. And so you should check on that frequently if as soon as those are posted, and we hope to get them posted very quickly. So with that, Cameron, I think it's going to be to you to try to tell us which questions have come in, and we can get our panelists to, or Amy, I'm not sure which, and our panelists to answer those questions.
Amy, do you want to take it?
Sure, thank you. So some of the questions have already been answered in the Q&A box, but we do have a few call-in people. So I think it would be helpful if we also answered those live in addition, but let's start with the ones that have not yet been answered. So what is the difference between a subcontractor and a consultant?
Sure, I can take that, and again, other people can if they want to. Consultant is usually an individual who's doing a set amount of work for a period of time. It could be a few hours, a few days, a few weeks, depending. It is usually a single individual. There's usually a consultant agreement with that individual. There typically aren't any other charges but that individual's time. So there is a rate for that individual's time, a daily rate, for example, for a consultant's time. Subcontractor is usually an organization. They may have multiple people working on the project with you, not just one. They may have their own F&A rate that they charge, or other parts of that. So it is really working with an organization versus working with an individual whose charges are simply their daily rate, for example, for their time. I don't know if Tisha or Laura, if you've got any other insights into that, but that's typically the difference between the two.
Okay, the next question is, if my proposal is not accepted the first time, can I reapply, and will there be feedback/reviewer notes on the proposals?
Yes, that's actually an excellent question, probably something I should have mentioned. There will absolutely be a summary of the reviewer comments that will be sent to each of the applicants. All of the applicants will get a summary of the reviewer notes, things that could be changed to strengthen an application, and we would very much recommend that if it's a strong proposal with just a few issues that need to be attended to, that be resubmitted in a later round.
Great. The next question is there a letter of intent process? If I am understanding right, it sounds like 1 to 2 applications. Sorry, the question disappeared. 1 to 2 applications funded per cycle. So wondering if there is a process that will limit the number of full submissions to those of highest interest.
Actually, there is not. We did make the application as streamlined as we could with just 5 pages and some additional documentation that is needed, but there isn't a letter of intent process. We expect to get the full proposals and be evaluating those full proposals.
Okay, and let's see what the other open questions are. So some of the questions that have already been answered in the chat. First one is, can a postdoc be a PI on this grant?
Yes. Yep.
So the answer in the chat box is yes, but keep in mind that the award will be made to the institution, not the individual. Therefore, an application from a postdoc should address and include assurances of institutional support for the duration of the award.
Yep, exactly. Thank you, Amy.
Okay. And a question about IRB. For the IRB requirement for human subjects, does the grant allow a budget line item to pay for the IRB? And
yes. Yes.
Okay. If legal services organization is working in collaboration with researchers on a potentially fundable project, would it be preferable for the researcher to be the primary applicant, or could the legal services organization apply as the lead?
Yeah, there isn't a preference, at least in my mind. I sort of welcome others. Whoever is the person who's going to be primarily responsible for the conduct of the research, or who is the lead on that, really should be the applicant organization. And so if it is the non-research organization, that's terrific. Yeah, you should apply and have your researcher as your partner. Either relationship is fine, really.
And Rebecca, I would just add to that to remember that it's the applicant or the organization is the recipient of the award. And so that will, that has the implications, and you can also reach out for personalized feedback if you have really technical questions of that nature.
Great, thank you.
Okay. Another question is, if you are a policy and applied researcher working within a criminal justice agency, would you apply under the practitioner initiated grant category?
You know, that's a really hard call for me to some extent. We've asked people to self-identify. I think one of the reasons we tried to put those descriptions, if the PI is a trained researcher who is used to conducting research projects, and whether it's with a research organization or in an applied setting, I might categorize that as a researcher initiated application, even though the organization might be an applied setting. I welcome Tisha or Lori, your thoughts on that as well.
Yeah, Rebecca, I actually said, I think, if they're coming from a CJ agency, you might not have some of the institutional resources like an IRB that someone who's applying on the researcher initiated. But particularly if you've never had NIH funding, but you're based in a justice agency or a behavioral health agency or some other service setting, I think the practitioner track might make sense for you. But again, I would definitely encourage you to reach out for personalized feedback so we can understand your particular situation and give you the best advice. There are real people on the other side of this, so we will take all of that into consideration. There's not a lot of difference between the two, but the main differences are for the practitioner initiated one. We don't necessarily assume that you have IRB infrastructure or you have some of the infrastructure that's pretty common in research settings. And that's really the primary difference between those two. It's not like there are different pots of money. We just ask you slightly different questions based on what we know your likely existing infrastructure is.
And I appreciate that. We've spent a lot of time trying to differentiate those, but they're, as you said, real people at the other end of this that have very specific functions and backgrounds.
Okay, a few new questions came in. Can individuals who work as consultants/researchers apply for this grant if they will collaborate with nonprofits to provide services? If so, who should apply as the lead?
Again, I think Lori, your comment earlier, about Tisha, your comment earlier, and I would encourage you to follow up with what I'm going to say. It is an organization that is applying, not an individual. And so it is an organization that needs to apply, and the PI should be, generally speaking, a member of that or affiliated with that organization. I welcome your thoughts on that as well.
I would agree with that. It's typical. One, we're trying to remove some of the barriers to NIH funding, but one of the barriers we can't remove is that our funding goes to organizations, not individuals for the most part. So you do need that organizational infrastructure. And so you should take that, again, you can reach out for personalized feedback, but you should have some, if you are to the lead on this, you need some kind of organizational infrastructure to support your application.
Okay. And the next question is somewhat related. Can a full-time PhD student who is an RN with former capacity in the mental health and teaching arena, but not currently full-time employed, be eligible to apply?
So Rebecca, I'll take a crack at this. I think if this would be similar to the postdoc question, if you can apply through your university and your university can give assurances of support for the duration of the award, and you can make the case that that makes sense, then I think that that kind of application would be eligible. But you would want to, again, in that case, I think I would make sure that you reach out for some personalized feedback. Again, just the underlying point is you do need some kind of organizational infrastructure that you're applying to, applying through that supports your application.
Great. And next question is, if 1 to 2 awards are awarded per cycle, is there any estimate of the total numbers applying per cycle?
We don't know yet. This is the first cycle. We will certainly know better in July. But right now we don't know. So stay tuned. We will know in July and be able to provide for the October call a little better information on that question.
Okay. Can the institution's research office that creates a profile, can they have more than one login to access the same application before submission? The example, can my university office be the applicant, but myself as PI have access to upload required documents, etc.?
I think at that point, it would really just be sharing the email and password that you have created with your office of sponsored programs, for example, from a university level, or the part of the organization that submits grants for you. If you've created a profile, you can share that information with them. If they've created the profile, they can share that information with you so that you can upload it. That would be the easiest way to do the way the program, the way the portal is currently configured.
Okay, and can a state agency apply?
I'm seeing yeses from NIDA, so I was going to say yes. So the answer is yes.
Okay. And should questions that are not related to needing technical assistance, but to match to JRIG priorities, go to a project officer or to the TA provider?
To the TA provider, unless the only time you need to reach out to the PO is if you have an existing NIH grant and what you're proposing is closely enough related to that grant that it could be considered supplement, or if you have an idea and you're not sure whether you should go R21, R03, or for this, your PO can probably provide the best feedback on that, simply because the TA providers are not going to be as well versed in the NIH mechanisms. They do not have access to information about your individual grants. So if you are in that situation, you should reach out to your PO. But if it's about the overall program, this is being led by Rebecca and the rest of the team at the Coordination and Translation Center. So you should reach out there generally for overall priorities.
Tisha, the only thing I would suggest that we add to that is there really is no wrong door here for questions. So if you can't figure out who to ask, just ask the TA team and they will triage questions to us. It's also possible that there are a number of people who are working on grants that are not funded by our team. So there may be other POs at NIDA who have no idea what JRIG is and wouldn't know how to answer your question. So go to the technical assistance email inbox if you don't know who to contact.
Okay, and then there were also questions about the link to the application. So you will, you can see that in the answered piece of the Q&A box. There was also a question about a phone number to call. Rebecca, is the best process to email and then have us call you back?
Yes, that would be, particularly now in sort of the period of COVID where we are all working remotely, or many of us are working remotely. The best way would be to use that email box. It's also the box that is being monitored by more than one person. And so it is really the best way for you to try to get a hold of us. And if it's more complicated, that can be done by an email. We can contact you directly. So yes, please use that email address.
Rebecca, I just want one of the questions I do want to point out, if anyone clicked or tried to type that bit.ly link, it is a 0, not a letter O at the end, apparently, unless you want to join a Spanish wine club. So thank you to,
Okay, thank you for
to
that.
someone for letting us
Yes.
know that. So make sure you put a 0 there.
It's always bad when you making the bit.lys, or even in any generated login. Other questions, Amy?
I think we have covered the open questions. There are some lovely thank yous in the question box, so we appreciate that.
And did we
yes.
have, someone had a hand up earlier, but it looks like they must have put their hand down and put that in the question box. So.
Well, I certainly do love giving people a half hour back in their day. I will give us a few more minutes just in case a question is being generated and has not yet quite made it to the Q&A box. It is certainly not your only time to ask us questions. Do use the JC Pilot at gmu.edu as a way to get a hold of us and answer additional questions. You may have them as soon as you log off of this webinar and the really important question comes to mind. Please do that.
And Rebecca, just to repeat, and for those who may not have seen it, if you open up the chat box, Cameron has posted both that email address and the bit.ly link.
Excellent. Anything else, Amy?
I'm not seeing any new questions. Just a reminder, we will, if you missed any of this, we'll be compiling a list of the Q&A, and then the recording as well as the slides will all be posted. Okay, one more question. Can the JRIG team speak about if they have particular priorities beyond the domains on the slide/call?
Do you want to go back to the slide that had the priorities?
Sure, and we actually have them more in the call, I think, where we list some examples. I think we list up to 9 examples. It's less on the slide, I think, than it is on the call. I could certainly try to bring that up. But those are really just examples. They were not designed to be exhaustive. The piece of course that was recently added is the impact of COVID-19 on virtually every aspect of the work that's being done in justice settings, certainly with individuals with substance use disorder. So, but we don't have any preconceived notions, at least as far as I know, to what that would be.
Rebecca, maybe one thing just worth noting, this is, I know the title of the network is the Justice Community Opioid Innovation Network, which might lead you to believe that we are only interested in opioid work, but that is not the case. So I think our goal with this overall program is really to shorten the space between what is happening in the field, innovations and interesting things that are happening out in the real world, and generating research evidence related to that. So you should be at the intersection of substance use and justice. But as long as you are at that intersection, we are probably open to the ideas that you might have, particularly if they are very responsive to how things are evolving quickly from where you sit and out in the real world.
And I sort of want to emphasize one of the things that we talked about is this notion of something that's happening immediately, new policies, new procedures that you are implementing right now, and you'd like to gather some information just about some data about that as it's happening in real time, but you need to do that during this window, because a year from now that window may be closed because you've already implemented it and can't get that initial data at the time that you're doing it. Those are the kinds of things that would be very appropriate for this type of rapid turnaround funding. because it does shorten that window from the time that you apply to the time that you're funded, in a way that may make that kind of data collection more easily accessible.
Okay, and another question was where the slides will be posted, and as Cameron put in the box, they'll be posted at JCOIN-CTC.org.
I'm looking through the other. I was going to say, if
That's everything we have so far.
okay, so I will not keep people. If you all your questions are answered, we really thank you so much for taking the time to attend the webinar, for your excellent questions, for your interest in the JRIG funding and the grant application. Please do continue to send us your questions as you have them. Reach out for technical assistance. Use the technical assistance documents and examples that we have posted, so that you can write the strongest proposal that you can. We are very excited about this initiative and making these grants available for real time and very real issues and questions that are happening in the field. So with that, I'm happy to let people go and have a half hour or so back in their day. Again, do feel free to reach out if you have any other questions. And thank you to our panelists. You guys are terrific. I really appreciate your help.
Thank you, everyone.